you guys have mentioned a couple of times that there's other groups out there that do this kind of modeling. We have Congress's scoring arm, the Congressional Budget Office, CBO. We have the Administration's Office of Management and Budget, OMB. H&E scores sometimes don't match up exactly to what either CBO or OMB projects. I know we just right before coming on to record this, we had the CBO score come out on the proposal you guys talked about under the Build Back Better plan. Why is this? What's going on here?
Yeah, we're still actually reading the CBO score, so some of this is gonna be speculative. But Steve, I mean, this is probably a great opportunity for you to talk about kind of how baseline assumptions matter and why you'll get different sorts of numbers, and those aren't necessarily wrong.
Yeah, it's really a good point, Chris, because I mean, one of the biggest concerns and what's intriguing is that, CBO has had multiple baselines if you look back over a period of time when they forecasted ACA take up, and so have we, to be fair, in terms of where things have been. Part of it is actually one of the biggest assumptions that's made is the Medicaid expansion market. And so, and even when we first built our state modeling capabilities, like, it was an interesting scenario where we actually, and we published this in a journal, in Health Services Research, we actually came up with exactly what would happen from the Supreme Court decision in 2012. And we picked a few states that would happen. The problem was the states were exactly the wrong states, but yet the top line number was right. We got lucky in sort of completely erroneous way. But what goes on with CBO now is that this expansion thing is still a major concern, because it's like, how do you model what a state governor or state legislature is going to do? You have some speculation based on red state, blue states, where people are voting, but I mean, different states are moving at different inertia. It's clear that not all, blue states have, all blue states have, but not all red states have necessarily expanded, and certain ones are holding out. What CBO assumes, though, is that by the end of the decade, more or less, everybody has expanded. And so that actually changes their baseline calculus quite a bit in terms of where both the cost and the coverage numbers come in. We, on the other hand, are like, we don't know. I mean, we don't speculate, do the political economy thing to say like, well, maybe Texas will go blue in 2028 and that will lead to X changes in 20. We don't do that. If we did, I mean, that would be different, but that does lead to substantial changes, for example, of where those assumption changes might be. Same thing with the employer-sponsored market too. Like CBO is assuming there is a big difference in the employer-sponsored market and Build Back Better. We could do that. We chose not to. We chose to focus on the individual insurance market. In part, there's been tons of speculation that the employer-sponsored market would collapse because of ACA, and we just still haven't seen it. So that's one reason for us to be a little bit conservative, as assuming that essentially that market will erode as fast as it will.